My job is essentially to find the kind of idiosyncrasies in the way people move to kind of identify where their injury has come from. If it's a movement related issue and people are getting long-term kind of repetitive sort of strain type injuries, then often it's something to do with the way they move their mechanics. So that's my job basically. We have a really good integrated service here, so we've been able to get people walking when they didn't think it was possible, and something so simple as that, can change someone's life. Essentially, we call it a biomechanical assessment, and I'm kind of looking top to toe to see if I can find any asymmetries in movement, in posture, in range of movement in the joints, in muscular strength, to see if we can correct it in some way. So I will do a postural assessment, getting you on a pressure plate to see, where your center of mass is, whilst also, having a feel of the pelvis to see if that's malaligned, see if that's twisted, or see if one side's lower than the other, and see if that correlates to your knees, to your feet, and sort of basically get an idea of what's going on. And then onto the walking gait or running gait analysis to kind of pick out kind of anomalies in the way people walk, whether that's up in the torso, whether that's at a hip level, whether that's knees, whether that's feet. Then I will get the patient down on the bed to have a look at range of movement, strength, see if there's any restrictions in any joints to see exactly where the pain is, and then I'll do some treatment based on that, whether it's changing the mechanics of that person, so making them an orthotic, an insole, which would sort of change the way they walk, and also looking at things like manual therapy to try and release joints, and that's probably something that we do a little bit differently to other podiatrists and biomechanists, is actually look and do some therapy whilst we're here, whilst we got the patient on the bed.